Jeff, good afternoon. Let's begin with an overview of the data. Our 7-day average is about 149,000 cases per day, and the 7-day average of hospital admissions is about 12,000 per day. Our 7-day average of daily deaths has increased to 953 per day. Today, I want to focus on COVID-19 and children, and importantly, what we can do to protect them. As a mother of 3 and as a physician, I deeply care about keeping our children safe at home and at school. Tomorrow, CDC will publish 2 new studies in the MMWR that specifically look at COVID-19 and children. These studies compare pediatric cases, emergency room visits, and hospitalizations during the prior winter surge when vaccination rates were low, with this summer when adult and adolescent vaccination coverage is increased and the Delta variant is the dominant variant. Both studies, one thing is clear. Cases, emergency room visits, and hospitalizations are much lower among children in communities with higher vaccination rates. Vaccination works. The first study analyzed data from hospitals in 99 counties across 14 states and found that the hospitalization rate among unvaccinated adolescents, those aged 12 to 17, was nearly 10 times higher than that among fully vaccinated adolescents during the month of July. The second study looked at national cases, emergency room visits, and hospitalizations, and found that in August 2021, the rate of hospitalization for children was nearly 4 times higher in states with the lowest overall vaccination coverage when compared to states with high overall vaccination coverage. Both of these studies included data from the past 2 months when the Delta variant became the predominant variant across the country. As cases were increasing throughout July and August, the number of children getting sick with COVID was also increasing. From late June and to mid-August, in the context of low community vaccination coverage and the rapid spread of the Delta variant, cases for children and adolescents 17 and under increased by nearly 10-fold, which aligns with the increase seen for the general population. And although we are seeing more cases in children and more overall cases, these studies demonstrated that there was not increased disease severity in children. Instead, more children have COVID-19 because there is more disease in the community. What is clear from these data is community-level vaccination coverage protects our children. As the number of COVID-19 cases increase in the community, the number of children getting sick, presenting to the emergency room, and being admitted to the hospital will also increase. I want to emphasize 3 important points to protect our children. First, we must continue to vaccinate all of those who are eligible to protect our younger children from disease. Communities with high vaccination coverage are seeing lower pediatric cases and hospitalizations. Second, wearing a mask in public indoor settings and continuing to practice the prevention strategies we know work are important to prevent further increases in cases and hospitalizations, especially for those children too young for the currently available vaccines. And third, with case rates in children high, it is important for schools to follow CDC guidance and ensure that all students, teachers, staff, and visitors to schools wear masks and that there are additional layers of protection in school. We know what we need to do to protect our children. Get vaccinated, wear masks, and follow CDC guidance. We must come together to ensure that our children, indeed our future, remain safe and healthy during this time. Thank you. I'll turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. I'd like to spend a couple of minutes now going over recent data from Israel supporting the rationale for COVID-19 booster shots. So on the next slide, we see new PCR positive infections and new severe COVID cases in fully vaccinated people during the Delta wave in Israel from June 1st up to, in this case, August the 1st. So clearly, Delta is dominant and is responsible for new cases, including severe disease. Next slide. However, in a study that began 2 days before the August 1st deadline I showed you on the prior slide, a study of a third booster of the Pfizer vaccine was approved for individuals 60 or older, and 1.1 million who were eligible for the dose got it between July 30th and August the 22nd. And a rather substantial positive impact was seen. 12 days or more after the booster dose, there was a greater than 10-fold diminution in the relative risk of both confirmed infection and severe disease. And in this paper by Baron et al., on the next slide, the individual data are shown. So if you go from left to right, the bottom dotted line is the dashed line represented no additional protection. On the vertical axis is the fold reduction in risk of 3 doses compared to 2 doses. So the numbers 1, 3, 5, 7, that would be 7-fold reduction in risk or 9-fold reduction in risk. And if you eliminate the 1 and the 2, which is probably bias there, psychological bias, and look at what happens from day 3, 4, 5, 6, and on. When you get to day 12, you see a substantial diminution in risk of infection. And in fact, that represents here about 1 million individuals who received their 3rd dose. And if you look all the way on the right, you see about a 10, 11, or 12% reduction. Next slide. Looking at it in another way, in a different study, when you looked at the reduction in the odds of testing positive comparing 2 doses versus 3 doses of the Pfizer vaccine. And in this study, in a 1 HMO in Israel, the Maccabi Healthcare Services, looking at more than 150,000 people in the first 3 weeks of August, they compared the 2 dose with the 3 dose, and they found after 7 to 13 days, up to 68% reduction in the risk of infection. And after 14 to 20 days, a 70 to 84% reduction in the risk of infection. There's no doubt from the dramatic data from the Israeli study that the boosts that are being now done there and contemplated here support very strongly the rationale for such an approach based on the very favorable data associated with boost. I'll stop there and back to you, Jeff.